Michelle, and we are on the affirmative side of elective abortions after the first trimester should be prohibited. First, let me explain the term elective abortion. According to Britannica, an elective abortion is the interruption of a pregnancy before the 20th week of gestation at the woman's request for reasons other than maternal health or fetal disease. Okay, what is a trimester? For those of you that aren't aware, the first trimester is week 1 to week 12, second is week 13 to week 26, and then week 27 to the end of pregnancy is considered the third trimester. So, how the babies develop. During week 1 to week 4, the body is basically preparing for pregnancy. Week 5 is the embryonic period when all the baby's major systems and structures develop. For example, the blood cells, kidney cells, nerve cells, they all develop. The baby's brain, spinal cord, and heart begin to develop as well. This is also the stage where the baby is at most risk for damage for things that may cause birth defects, such as medicines, illegal drugs, and heavy alcohol use. It isn't until week 15 to 18 that the baby starts to develop, or it starts to move and stretch. It also, week 19, the baby can start hearing things. The mother can feel fluttering in her lower abdomen, and it's called quickening, when the mom can feel the baby's first movements. So that's week 19 to 21. Week 22, it's when the baby grows nails at the end of their fingers, and then you can hear the baby's heartbeat through a stethoscope. Can the baby feel pain? So what we're arguing is that women that get abortions after the first trimester are at greater risks. It is immoral for a late abortion, and also we want to create laws that change it in order to make this possible. We need to create laws. So can the baby feel pain? According to Is the Fetus Conscious study, sensory receptors for pain develop around the mouth at week 7 and are present throughout the skin and other surfaces by week 20. Connections between the spinal cord and thalamus complete by 20 weeks. So if they have all their pain receptors, how can they not feel pain? I ended up finding a testimony by Dr. Anthony Levatino, and he was an abortionist that did late-term abortions. He basically walked us through what an abortion or what a late-term abortion would look like. First, the woman's cervix needs to be stretched open. Then, with a suction catheter, he suctions the amniotic fluid out. Then, using Sofer clamps that are stainless steel clamps with sharp teeth, they use it to rip the baby apart from limb to limb. The most difficult part of the step is crushing the baby's skull from within the size. Crushing the baby's skull. At this age, his skull is the size of a peach. So in order to extract it, they need to crush it into tiny pieces. And then they take out any remaining tissue with a curator. And by the end of that, to make sure that they retrieve all the baby, they have to put it all together to make sure they have the 2 arms, the 2 legs, and so on. Another study I found in 2013 that was done used functional magnetic resonance imaging to study the brains of healthy human babies within the womb. From 24 weeks to 39 weeks, they found that the function neuronal connections sufficient to experience pain already existed by week 24. So it's just another point to prove that babies do feel pain during the second and third trimester. The main question that my opponent might ask is, why do women get late-term abortions? Some of them, or they might argue that women get abortions because they realize that they don't want to have a baby or they get raped, but I'm here to challenge that all those choices could have been made in the first trimester, whether it was taking contraceptives that were needed, or for an example, the abortion pill, which is to be used within 72 hours of unprotected sex.